Welcome to the Caregiver Relief Podcast, where we bring clarity, compassion, and practical guidance to family caregivers and aging adults. I'm your host, Diane Carbo, a registered nurse, and today we're talking about something many people don't realize that can quietly impact health as we age: viruses that linger. My guest today is Linda Mac Dougall, a holistic health practitioner, author, educator, and massage therapist who specializes in working with seniors and individuals with disabilities. Linda brings decades of experience from direct care work and mental health settings to serving as a federal advocate for Hawaii's developmentally disabled. Her work bridges physical observation, emotional insight, and real-world caregiving challenges. Today's conversation focuses on Epstein-Barr, shingles, and other viruses that can remain dormant in the body and reemerge later in life, often contributing to fatigue, pain, brain fog, or symptoms that may be mistaken for just aging. We'll explore how these viruses affect seniors, why caregivers should be aware of them, and how a holistic observational approach can help identify concerns earlier. This episode is meant to educate and inform, not diagnose, but it may help caregivers ask better questions, notice overlooked symptoms, and advocate more effectively for their loved ones. This episode is sponsored by myvitalvault.net, your all-in-one life organizer for aging adults and caregivers. It's designed to help you securely store your essential legal, medical, and emergency information in one easy-to-access place. Because when a crisis hits, being prepared can make all the difference. Join our Caregiver Relief community, a warm, welcoming space where you can connect with other caregivers, ask questions, share stories, and find support from people who truly understand. Visit community.caregiverrelief.com to join now, because caregiving is one of the hardest and most meaningful things you'll ever do, and no one should have to do it alone. And if this episode speaks to you, please take a moment to like, share, or comment. Every click helps us reach more caregivers who need encouragement, resources, and hope. Let's welcome Linda. Linda, thanks so much. I love when we have our conversations because I want our listeners to know you're a regular contributor. And we often talk about the challenges of aging and that are not often addressed. So before we dive in, what first sparked your interest in the connection between viruses like Epstein-Barr and chronic health in seniors?
I guess it was a year or two ago, I ended up all of a sudden getting two multiple sclerosis clients at about the exact same time. And one of them I stayed with for a while, and she was praying every night just to die. She was impacted by her disease, and she was in a wheelchair in a little apartment with a cat. And I just felt so sorry for her.
Yes.
Because I knew she didn't have money as well. So I told her she could pay me whatever she could afford.
Yeah.
Don't normally do, but I knew in her case she needed what I had to offer.
I do the same thing. I do. I get it. Yeah.
Yeah. So I just started doing research on MS because I hadn't actually run across MS clients before.
Okay.
And right off the top, I'm reading and I see that often Epstein-Barr is at the root of multiple sclerosis.
I didn't know that, but when you told me about that initially, I looked it up and I started looking because I'm seeing MS. I'm 72, but I have people around me that are getting diagnosed with MS. And I was shocked because that's not a common disease, but it's like more prevalent than it's ever been, I think.
And the fact that neither one of these ladies that I got out of nowhere suddenly,
Yeah.
none of them had their physician do a viral load test or given them any antivirals. Now, if you're a doctor, shouldn't you be doing that? Both of these women were getting pain pills and muscle relaxants, and that was it. So nothing was being addressed.
I'm seeing that more and more too. I'm seeing that, in fact, I know a nurse friend who is in the same situation. She knows she needs better care. She knows, but nothing's getting addressed. And unless you really advocate for yourself, you get lost. For the listeners out there who may not know, what is Epstein-Barr virus and why is it so common?
It is very common. I don't know exactly what it is other than a virus. I know also that my parents both had Epstein-Barr because after they passed and going through their stuff, there were medical tests that showed they had a viral load test, both of them for whatever reason. And Epstein-Barr was the highest one there. They both died of different cancers. So my dad had my mother had bone cancer. My dad had lymphoma, I think. No, leukemia. I knew it was an L.
Yeah, yeah.
So yeah, they both had different cancers, but they both had Epstein-Barr too. And Epstein-Barr, as well as other viruses, are at the root of some cancers as well.
Now that I am learning too. Now, Epstein-Barr, does it typically show up in childhood or adolescence or in later life? Do you have any idea?
My guess is it shows up fairly early because it is so common.
Okay, okay.
So many people have it that my guess is it comes on fairly young and just stays around for the rest of your life.
I was reading just the other day an article that was saying that we are a culture that has a lot of chronic fatigue and that these illnesses, these viruses are dormant in us. And
Yep.
we're seeing a lot of people that are going undiagnosed. And that surprised me because Epstein-Barr has been around for forever. And I just thought our medical delivery system was further along. But I think we only get 15 minutes of time before a doctor. So they don't, I think doctors are missing a lot because they don't have a chance to really listen to the patient and get their signs and symptoms and really connect it to be able to provide a diagnosis.
And I think that's very true. I know I had a friend who said that she would get to her doctor, get out, and later she'd get that written report of their visit.
Yes.
She said he had questions in there with answers, and he had never asked those questions, and she had never given answers. But he has to fill out for the insurance company that he asked these questions.
Yeah, yeah, yeah. How does the chronic fatigue or Epstein-Barr virus lay dormant for so many years?
Oh, all viruses you get pretty much lay dormant once you've gotten them. And you just have to make sure you get enough immune system support, especially antivirals, and there are many natural antivirals, that you can keep them submerged and not flaring up somehow or other and giving you problems.
I just had recently, just this week, one of my clients called me and says, I have this pain that's on my chest. It's not chest pain, but it's like the skin hurts and it's radiating down into my arm. And I said to her, are there any blisters or anything? And she says, no. I said, get to the doctor really fast because you may have shingles. And it was shingles, but she caught it very early and she was able to get the viral antiviral medications. Now, the other day, she's still in a lot of pain. It's very painful, and people don't understand that shingles, how painful they can be, but they really go hit the nerve. It's all along the nerve. And she's a relatively young, healthy 60-year-old, and she's really in a lot of pain. But I said to her, hopefully that the virus with the antiviral medication, she's going to decrease the time she had it. Now, what she did have just yesterday, she told me, because she's been on it now for 5 days, she had one little outbreak, tiny little blister on her arm break out. And that is all. That's a blessing. And I think that she is going to be able to avoid her recovery instead of 6 to 8 weeks or longer is going to be maybe 2 weeks, because she was proactive in getting to the doctor right away.
I caught that on my father when he was in his odd dementia state and living with my sister for the last year of his life. And I was there visiting him. She was at work, and he started little bitty complaining about something on his side. So I lifted up his shirt and looked, and I go, think I know what that is.
Yes.
So I looked around in my sister's medicine cabinet and found some coconut oil, put that on him because coconut has some good antivirals in it.
Oh, okay.
And smeared it on him. And then I told my sister, you need to get him to the doctor. I think he's got shingles.
Oh, and that is so painful. It is.
He luckily didn't have a whole lot of pain. I had a tiny outbreak that I'm pretty sure was shingles, maybe a year or more ago, but it was so mild because I had one shingle shot a while ago, and things started happening and nothing ever got the second one. So I never got it. So when I had that, I said, that's probably what that is, but it'll go away fast because I'll treat it.
Yes. Can you talk about some of the long-term health effects or flare-ups that caregivers should be aware of with these viruses?
Shingles, we just talked about, that's it often resurfaces if somebody doesn't have the shingle shots and things like that. The herpes virus, either herpes 1, which is oral, or herpes 2, but they can be mixed up depending on what you've done with your sexual life.
Yeah.
So you can have herpes 2 elsewhere and herpes 1 elsewhere. I once knew a young man who had his herpes outbreaks all over his face.
Oh.
That was so weird. I had never seen anything like that. And it wasn't just a little canker sore. It was the whole face was involved. So herpes can live on the nerves just like all the other viruses can live happily on your nerves. Yeah. But you need to keep them under cover and not let them flare up if you can. And if you do get to a point where they flare up, then you need to treat them real fast, either naturally like I do or with the shingle shot, which I had, like I said, one of. I never got the second one because of the...
I actually know a woman that had the old shingle shot decades ago, and it literally caused her to have ongoing shingles. It was awful. She lived every month she would break out in shingles. It was awful. And of course, she did have to go. This was before. Now, the new one, I feel that it must be much safer. But she just was a person who had an adverse reaction to the vaccine that affected her immediate health on a regular basis. How do these viral reactivations present differently in seniors compared to younger adults?
They're usually stronger because we have weakening and weaker immune systems. So they're going to be stronger. And like I was real happy I only had a very mild thing that I figured was shingles. I didn't go to the doctor because I got rid of it real fast. But my dad also was very mild for someone of his age because he was in his 80s at that point.
I want people to understand that if you think you see a cold or you have these unusual pains, you really need to go into the doctor as soon as possible. Let them see it, diagnose it, and treat it with antivirals, because the sooner you get in and get treated, the shorter your recovery is going to be. And I think that's really important. Now, Linda, I'm going to ask you a question. What symptoms might mimic or overlap with dementia, chronic fatigue, or other autoimmune issues? Because your dad had dementia, I think you might be a good person to understand this.
With chronic fatigue, it's part of viral underpinnings or part of the autoimmune problem. So again, somebody needs to be testing and treating for the viral component. And I don't know that happens much either, because I've known plenty of people with autoimmune disorders and I never heard once of an antiviral.
Yes. I think my goal here is to encourage caregivers that have a family member that may have shingles or Epstein-Barr or chronic fatigue to actually ask the doctor to do blood work to look for viral overload. That's really important. If that's the one key question that I want people to ask their doctors, that is one, because things get missed in our medical delivery system right now, and it's very sad, but we have doctors that are not getting enough time with us to really understand what's going on, and they're in a hurry to get to the next physician or the next patient. And I'm seeing this over and over where things are getting missed a lot. In fact, I'm seeing in hospitals where nurses aren't turning patients because the patient doesn't want to be turned, because they hurt, skin is breaking down, and other complications are occurring because they have rights to refuse care, which is so harmful. So I think we're and they're not looking at their skin all the time, and they may miss a nurse, even in the hospital, may miss the stuff because they're not checking their bodies.
And being a massage therapist, checking the body is real important, because massage is about the only place you get that anymore.
You know what? You're absolutely right. I have horror stories I'm hearing right now that aren't related to this, but it's just a lack of proactive care and in nursing. It's just the nature of the beast right now. Now, can you tell me what role the immune system plays in keeping these viruses quiet or allowing them to resurface? Can you explain a little bit about that?
Well, anytime your immune system lowers, you're prone to get anything that happens to be floating around, not only in your system, but out in the world. I was lucky during COVID. I never got it. But a lot of people did. Long COVID is that particular virus reactivating and causing people trouble constantly. I've got a very good friend who's got long COVID, and I haven't seen her in years, but I've talked to her on the phone, and she sounds horrible.
Yeah.
And she's younger than I am.
What gets the immune system out of whack?
What gets it out of whack?
Yeah.
Poor diet, being exposed to maybe too much of something.
Stress.
Like with COVID, all you have to do is be around it.
Yeah. Stress is another one. But I think people don't understand poor diet, poor hygiene, like not washing your hands.
That's why all the alcohol.
I know. Yeah. There's so many things that people can do to improve or enhance their immune system. I know you take a holistic approach. So can you tell me some things that a person can do to enhance their immune system?
Yes, of course. Garlic. Garlic is one of your best.
I love garlic. I can't help it. I put it in everything. And people go, oh, I don't even care that I have garlic breath because it's so healthy for you. And it has antiviral and antibacterial benefits. And I think that's really important. And I know people don't want to take garlic, but I don't know if the product garlic that they sell is any good or not.
That I don't know.
I think it's a processed product that I can't imagine it being good for you. or doing what
Want
it.
to take something like that? Let me go get it real fast. Now, I don't sell this or anything, but I found it to be one of the best. It's quantum super lysine, and it's got garlic and all sorts of things in it.
Okay.
And lysine will go against the herpes virus because I love peanut butter
Uh-huh.
and nuts and seeds, and all those things are high in arginine.
Uh-huh.
And if you take enough lysine, arginine will cause herpes breakouts. So
Okay.
lysine fights the arginine.
Okay.
And this has got super lysine, and then vitamin C, echinacea, licorice, propolis, and odorless garlic.
Gotcha. I know people avoid a lot of people. Some people either take lots of supplements, and then there's ones that don't take any. Are there foods that people can eat or foods that they can avoid?
Arginine foods, yes. Depending on what virus they have.
Okay.
But arginine is the one that helps the herpes virus break out.
Overall, what lifestyle or wellness practices can help strengthen the body against viral flare-ups?
Oregano oil is another one that's really good against many things. And it's got carbachol, and carbachol is an antiviral.
How would you use oregano oil?
Just little capsules.
Oh, okay. Okay. I'm not familiar with all of this, so I'm just curious.
Yeah, just little capsules. And of course, lysine, which we just talked about. And I'm going to read you some things because I did a whole thing on this because I was fascinated.
Okay.
Okay, so the replication blockers, because what the viruses do is they get into your cells and they replicate.
Yes.
So these are replication blockers: star anise, turmeric and ginger, curcumin, and there it goes, fresh ginger again. And it says the Bio Booster Trio mix is turmeric, black pepper, and coconut oil.
Interesting. So, are there treatments, traditional or alternative, that have shown promise in helping people manage chronic viral effects?
Basically, it's what we've just said.
Yeah.
Let's see. I did a lot of these, like I said. Okay, the bullet is zinc, and that's in oysters, pumpkin seeds, and beef. Zinc physically stops the virus from replicating. The gun, quercetin, is in onions, apples, and capers, and that helps the bullet zinc get inside the cells.
You know, I know that when people have decubiti, pressure sores, we up their vitamin C and zinc and increase their protein for healing. And so I know zinc has a lot of good properties that we don't eat enough of or get enough of or give zinc credit for. So zinc and lysine are two supplements that people may consider. I know I had chicken pox, I've had measles, I've had so many things, and I know that these viruses are lingering in me. I'm not a person who has had herpes viruses. I don't have cold sores and those types of things. But I do worry because when I get my brother, who recently had a bad episode of shingles, and I know that chronic fatigue is often labeled as it's just we're aging. And it's not, it doesn't have to be. I know for me that I'm 72 and people think I have high energy, but I feel tired all the time. And it's just had my blood drawn and they went over it and they didn't even tell me I was anemic when I went on my appointment with the doctor, but I looked at my blood work and I'm mildly anemic, which I've never been in my entire life. So I'm eating lots more spinach and that kind of stuff because I know stress and stress management's important. We can't let ourselves get stressed out to the point where we're going to get sick, and that's important. And we need to be aware of what we put in our bodies, because that's really important too. Eating healthy is really important, and getting out in nature every day. I know that sounds silly, but that alone can enhance your immunity just from uplifting your spirit and getting some fresh air in your lungs. So I worry because people discount when we say we're tired. And I'll tell you right now, I really feel that a lot of our healthcare professionals are not spending enough time with anybody to really see. That's why so many our chronic fatigue is a crisis in this country, which I didn't realize. I just read an article about that. And it's just people are not being diagnosed with these viruses, the Epstein-Barr, and I don't know what they're called, cytomegaloviruses. They're big viruses. Nothing small and tiny like the Epstein-Barr or the shingles virus. These are big viruses that attach to us. But people do struggle. And I think that the viral flare-ups, to prevent them, you need to take a holistic approach. And it's eating better. It's maintaining good hygiene. Wash your hands. Don't cough into your elbow versus into your hands, and to prevent that viral overload. As we have a flu coming around now that is hitting people pretty hard. And again, it's a virus, and people, if they know they're going to get it or have been exposed to it, need to get to the doctor right away to get Tamiflu or whatever the drugs are right now, because it can prevent them from being hospitalized, actually, or have their immune system compromised to a point where things like the Epstein-Barr or shingles will present its ugly heads again.
Well, you were asking earlier about dementia. It's not dementia in particular that is affected by viruses, but they suspect highly that the type 3 diabetes, which is Alzheimer's,
Yes.
is plaque buildup is from long-term herpes 1.
Ah, I did not know that. Yes. I know that people with dementia often have episodes of attacks with Epstein-Barr or the shingles. And it's definitely a virus that people ignore because they don't pay attention, because the person has dementia and they can't express what they're feeling. So, what can caregivers do if they suspect their loved one's fatigue, brain fog, or pain may be virus related?
I'd say get them to a doctor, but I'm almost thinking you almost have to get them to a specialist these days.
And you can't, and because of Obamacare and Medicare right now, we have a shortage of doctors and specialists. We are in really big trouble here, because that's why because the reimbursement rate is so low, doctors aren't going into medicine. They're going into other fields where they can make a decent wage and not have to be dictated by the government what you can and cannot do. And it's a crisis here for sure. But I think that caregivers that are interested in alternative medicine, I think it's really important to talk to some practitioners out there that are into helping people with the viral overload and addressing it on a holistic basis. But I encourage every caregiver or every senior that is not feeling well because they think it's chronic fatigue, or they have brain fog, or they have a pain going down into their nerves that is very painful, but their blisters haven't emerged yet. Get to the doctor, ask for a viral overload test. In fact, don't let them discount you, dismiss you. Just say, I want this. And
Exactly.
Because I know people think, oh, doctors are gods and I can't argue with you. I'm not telling you to argue, but you can be firm and demand that tests be done. And that will give you an answer. And then hopefully with the results of that test, you can get immediate antiviral medications that will address this. But you brought up the point that you put coconut oil on your father. So I know you're a holistic practitioner and you're very much into alternative approaches. So I found that fascinating because I would have never thought, I didn't know enough about coconut oil to even do that.
It's got I want to say lauricidin. It's got lauric acid. That's what it is. But lauricidin is another thing I have in my arsenal over here. And they're little pellets of coconut. And you do not want to chew those suckers. You want to swallow them right down with water. Let me tell you, I made the mistake of chewing them one time and I was sorry.
Oh, interesting. So they're coconut oil pellets that you take orally.
Yes,
And
right down.
yeah, and as a preventative for
A preventative, and if you feel like you're coming down with something, either way, you want to get that antiviral in there so that you are kept well, or kept as well as you can be.
So that's lauric acid.
Lauric acid is what the coconut. Yeah.
Gotcha. Because the first thing I always think of is echinacea.
Yeah, echinacea too.
Take echinacea when I think I'm getting sick. But I don't know if I don't know if it would work for viral loads, but viruses, but I do take it for colds, which are viruses. So I guess, yes. I'm thinking bacterial, but no, it's viral. What message of hope or encouragement would you give to caregivers who feel overwhelmed by the challenges of chronic viral illnesses in their loved ones?
Oh, again, get them to a doctor. And if there's no crime in moving doctors if you're not getting what you need from one, by the way, because I have changed several times and I'm still not sure I'm going to stick with the one I have now. I will keep going until I find somebody who will work with me correctly.
I'm actually recommending people go to a functional medicine doctor.
Yes.
I love
afford to do that.
Yeah, if you can afford it, absolutely, you need to do it because they're not just medical doctors, but they also look at medicine from a different approach, a very holistic approach. Everybody in our medical delivery system right now is very specialized. For example, when I first went into nursing, orthopedic surgeons used to do every bone in the body. Whoever was on call got the hip or the knee or whatever, and they did knees, hips, ankles, broken arms, etc. Now you have a doctor for hands, for feet, for shoulders. It's absurd. And doctors are
that way.
Yes, and everything is specialized now. It's absurd because there's no holistic approach to anything. Nobody takes a whole body approach. You do.
Therapist.
Yes, it's really unfortunate, but functional medicine doctors, if you can. But I say, Linda, how do people reach out and find you if they have questions about viral load and some approaches to help them?
Let me tell you, first of all, that recipe I gave you to send out to your people, that chef took functional medicine courses, which is why he does what he does.
Interesting. I'll put that recipe at the bottom of the the page we create as well with Michael's picture on it. And so he gets credit for the recipe.
Yeah.
But yeah, we'll include that's a recipe for a tea that you can drink several times a day that will help you enhance your immune system.
And I just met him and his company. He works for Restaura, Restaura. And I met that company's growth officer at the think tank I just came back from in Texas. And when we started talking and I found out that company works for senior feeding places, whatever that may be. So then he got me on a Zoom call with Michael and him and me. And Michael and I were going back and forth because we were both talking the same thing, same language. So yeah, there are people who know what they're doing food-wise, and there are people that know what they're doing functional medicine-wise, and that's so nice. Anyway, for me, I have a website. It's an older website. It's going to be updated shortly as soon as I get the funds coming in. I've got some funds hanging in the wind, and as soon as they come in, I'm having everything revamped. But it's loveyourlongevity.com. And you can also email me at speakerholistic@gmail.com.
Great. I'll put all that in the show notes and on the page that we create too. To my family caregivers out there, you are the most important part of the caregiving equation. Without you, it all falls apart. So please learn to be gentle with yourself. Practice self-care every day because you are worth it.